Recently, Blood Assurance donated $50,000 to ETSU's Quillen College of Medicine to develop a customized health survey for area high schoolers. Drs. Kiana Johnson and Liz Culler are here today to share with us why this survey is so important to the overall health of young adults in our region. Thank you all for being here.
Thank you for having us. We appreciate it.
$50,000 goes a long way to making something like this happen, and Blood Assurance stepped up.
That's what we're hoping to do. We've been in Johnson City for the last 3 years.
Right.
We supply all the blood products to Niswonger Children's Hospital and also Johnson City Medical Center. And we wanted to have a greater impact on the community. And also we realized that 18% of our blood donors are high school students.
Right.
So we're specifically looking at something that will help them have better health and help them be lifelong blood donors.
And for the medical school, this is a great opportunity to help our entire region as far as high schoolers' health issues.
Yes.
Talk to us about this survey. What's going into this survey? You say it's already completed.
Yes, it is completed already. So what we're looking at adolescents' access to healthcare. So how do they access healthcare, as well as what type of healthcare do they utilize?
Right.
And we're also asking about transition to adulthood. What do they know about managing their own health when they become adults and things like that.
And I was talking to you earlier that transition sometimes from high school to college or to the job market also means a transition from being on their parents' insurance to getting their own insurance. And this is helping out, asking some questions about that
Yes,
as well.
We also ask about if they know how to apply for insurance when their insurance runs out and questions of that nature.
And for Blood Assurance, you want to increase your donor base. And like
Absolutely.
you said, 18% is this age range.
Exactly.
And so any new donors you can get in, because you're always needing blood.
Through this project, we would like to call on area high schools to contact us and arrange a blood drive, and we will hook in Dr. Johnson, and we will help arrange for the survey together.
And this survey is ranging out all over East Tennessee, Southwest Virginia.
Yes, it is. Yes.
Just hitting several high schools, and you're wanting these high schoolers to come forward and be very honest about their health situations.
Yes, and the goal is to help facilitate access to healthcare as well as community resources for these adolescents.
You find out that here in Central Appalachia that sometimes they're not getting the health resources they need?
Yes, and it could be that they don't know what resources are available and things like that.
And for Blood Assurance, $50,000 is a great start to getting this done.
Absolutely.
Why did you as a company decide this is the right way to go about doing this?
Well, we did think it would just benefit everyone. We thought it would be beneficial to the community, to our blood donors, and to our healthcare partners.
And as a healthcare partner for Blood Assurance, I'm sure you're all glad to have this money because it helps you facilitate this, doesn't it?
Yes, it does. And the schools are also benefiting as well.
Right.
The schools will be receiving a summary of how the students in their school are doing.
I was going to ask, when the results all come back from these surveys, what happens then?
When the results come back, so we will provide the schools with aggregate information about the different topics that we ask the students, and then we'll also, we'll provide that to the school, and we hope that this will inform interventions to help youth access health care.
And ETSU Quillen College of Medicine, very centrally located here, so this is a great base for this survey to take place, isn't it?
Yes.
And let's talk about, when y'all were coming up with how can we facilitate this, what was some of the thought going into the process for coming up with this $50,000?
Well, we were thinking we would be great partners just because they're looking to touch a lot of youth that they don't really have an infrastructure to do, whereas our recruiters are already out in area high schools.
Okay.
So we thought we could kind of be the middleman and helping make the correct introductions and that sort of thing.
So it's definitely a win-win for both places.
Absolutely.
Yes. And the big winners here are all of our high schoolers.
That's right.
Yes.
All right.
That's the main thing.
Ladies, thank you all so much for coming by and sharing this information. It is good news. If you need more information about what's going on, check out bloodassurance.org. Check out that number there at the bottom. And if you're a high schooler and you get the chance to take this survey, I encourage you to do it.